Hello guys, this is David Villar and welcome to the second video on toxicants that affect the heart. This one will be on gossipol and toad poisoning. So gossipol is the toxic principle in cottonseed meal or cakes that are used as a protein source in animal feeds. Gossipol is a polyphenolic binaphthalene pigment that is present in the glands of the seed, which account for about 2 to 5% of the weight of the seed, and is mostly removed during the extraction procedures of the seed, but unfortunately not all commercial processes are very reliable extracting the toxic. So in the end, the concentration will depend on the method of oil extraction. As we can see on the table, the traditional method of mechanical pressing with heat is a lot more efficient than using solvents with no heat. In that traditional method of oil extraction, the seed are heated for a long period before they do mechanical pressing to expel the oil. And the precise mechanism of action is not very clear because a number of adverse reactions have been reported. The impairment of growth and hypoprothrombinemia has been attributed to the inhibition of protein synthesis, also by binding proteins and amino acids in the digestive process. The anemia may result from chelation of iron. It also inhibits lactic dehydrogenase in the testicles by competitive binding of a cofactor for its activation. This has been investigated as a possible human male contraceptive agent because it inhibits spermatogenesis. Now, the acute toxicity of gossipol is in the order of 5 grams per kilogram, which makes it basically non-toxic on an acute basis. So the problems will arise with chronic ingestions, and it is hard to put a single value because it varies a lot depending on the age of the animal, the species, the level of protein in the diet, and whether iron is properly supplied with the feed. In general, a threshold value of 100 parts per million in all species is safe. In pre-ruminant sheep, given diets with 600 parts per million for 3 to 4 weeks, it caused deaths, and levels of 250 parts per million for 10 weeks in calves caused cardiac failure. Adult ruminants are really highly tolerant, but they should not receive more than 1,000 parts per million, because levels of 1,500 parts per million have been shown to cause anemia, poor growth, and reduced milk production. Now, with regards to the clinical signs, the first thing is to point out that gossipol is the classical example of a toxicant that, in spite of its low acute toxicity, it has a cumulative effect, and so the signs will appear after at least 4 weeks or even months of chronic ingestion. And when they do so, they present abruptly in a number of animals, and they will die within 2 to 6 days after the onset of signs. They also mention that the appetite is good almost until death, and the most prominent signs in pigs are respiratory distress that include dyspnea, gasping, thumping. These are basically very violent labor respiration movements. And they will also show generalized edema as a consequence of the congestive heart failure. In calves, producers describe the signs as those of shipping fever that do not respond to antibiotics. They will have a rapid heart rate, pale mucous membranes, brisket edema, jugular vein distension, and wet crusty noses. As I mentioned before, mature cows are very resistant to gossipol. Studies that fed them 0.5% of their body weight, which is about 5 pounds per day per cow, did not show any problems. This seems to happen because they can detoxify the free gossipol by binding it to soluble proteins in the rumen. An exception is breeding bulls because it can cause infertility issues. So they should probably not be fed cottonseed before the start of the breeding season. Now, the lesions that the animals will show are all related or secondary to a congestive heart failure. The gross lesions will consist of widespread congestion and edema with large quantities of straw-colored fluid in peritoneal, pericardial, and thoracic cavities. The lines will be edematous and heavy and wet, and the heart will be enlarged with thin walls and may show some pale streaks that correspond to necrotic areas. The microscopic lesions can explain better those that we see grossly. The lungs will have interlobular edema. The heart will have myocardial degeneration and necrosis, as we saw for ionophores and oleander intoxications. And the liver will tend to have central lobular necrosis. So the diagnosis of gossipol intoxication basically includes a history of dietary exposure to cottonseed products for a very long time. The clinical signs of respiratory distress in multiple animals with no response to antibiotics, the lesions that are consistent with gossipol intoxication if you open up a dead animal, and obviously the presence of high concentrations of free gossipol in the diet. In pigs and young ruminants, the threshold value we mentioned safe is 100 parts per million. In adult ruminants that are a lot more tolerant, the concentration should not be more than 1,000 parts per million. And with regards to the treatment, there is no specific antidote for animals that are already affected. So basically we have to concentrate on fixing the diet to make sure the concentrations of free gossipol are within safe levels. If you can replace it with another source that is high in iron and protein, like soybean meals, that will obviously prevent further cases. And if you still need to use the cottonseed meal, there are ways to reduce the toxicity of gossipol, which basically are adding extra iron in the diet, such that the ratio of iron to gossipol is 1:1, and adding more protein to the diet has also been shown to reduce the toxicity of free gossipol. Particularly if you put more lysine, methionine, and fat-soluble vitamins. Now, the next one, toxicant, is the giant tropical toad. This was introduced to the southern states and Hawaii about 50 years ago for insect control. The toads produce the toxin in the parotid glands, which are situated behind the tympanum, and they extend backwards over the shoulders, basically at the junction of the head and the shoulders, if you like. If you don't know, I don't know if you may notice, but there are some numerous pinholes openings on the surface of the skin in those glands, from which the toxins can be manually expressed. So as you can imagine, the threat is to dogs that put the toads in their mouth. The toxins are basically bufadienolides, whose structure is very similar to digitoxin, and so the mechanism of action is like an overdose of digitalis-like compounds. There are also other toxins that include some catecholamines, serotonin, 5-hydroxytryptophan that probably account for the CNS effects. And one interesting thing is that within the toads of the same species, the ones, for example, that are in Florida seem to have a lot more potent toxins than the one in Hawaii. Now here is a retrospective study that was done in Florida in 94 cases. The most common clinical signs were neurologic abnormalities in 51 of them, which included convulsions in 22, stupor in 17, ataxia in 17, nystagmus in 16, extensor limb rigidity in 4 of them, and opus thotonus in 3 of them. They mentioned that 8 dogs had a status of epilepsy at the time of initial examination, and some of the other signs in decreasing order of frequency were hyperemic mucous membranes, hypersalivation, recumbency, tachypnea, and vomiting. So in all dogs, basically what they did is to lavage that oral cavity for at least 5 minutes with tap water. Basically, as you can imagine, the treatment is symptomatic. Diazepam was given as an anticonvulsant and a muscle relaxant to control the seizures and the extensor limb rigidity. 43 dogs were given IV fluids at either maintenance rate if the signs were mild, or at a shock rate for more severely affected patients. They did electrocardiograms in 54 dogs, and they say that the arrhythmias were not very common in most of them, but some of them still had to use some drugs like atropine if the heart rate was lower than 50 beats per minute, and propranolol if they had tachyarrhythmias like ventricular fibrillation. In the end, the outcome was favorable in most dogs. 89 of the 94 dogs made a full recovery. Only 4 of them died and 1 had to be euthanized. And they basically mentioned that the intoxication carries a good prognosis if it is quickly treated with just supportive and symptomatic care. Now here is another paper from Australia. In Australia, the cane toad was introduced in the 1930s to control sugarcane beetles. Since then, it has flourished throughout the country because it doesn't have any natural predators. As we can see in the table, most cases took place in small breed dogs, probably because they get a higher dose than big dogs. And many of those were terriers that they tend to be very inquisitive, apart from having a small body mass. So as we saw in the paper in Jaffna, the most frequently reported clinical signs was increased salivation in 78% of the cases, followed by red mucous membranes in 63%, seizures in 31% of the animals, and other clinical signs included cardiac arrhythmias, tremors, vomiting, altered mentation, and extensor limb rigidity. As we see in the table below, the outcome was considered excellent, and only 2 of the 90 dogs died and another 2 had to be euthanized. So if we treat those dogs according to their symptoms, we're likely to save most of those animals. And ideally, we should recommend the owner to perform an oral lavage at home before arriving at the emergency clinic. This can be done with a garden hose and a cloth to wipe out the animal gums. Obviously, if the animal is already seizuring or comatose, you definitely don't want to do this because of the risk of aspirating the fluid. And basically, to end the presentation, let's look at a clinical case in a Yorkshire Terrier that was found seizuring in the yard next to a cane toad that was partly eaten. The dog was rapidly taken to the emergency clinic where he was hypersalivating, had hypermetria and disorientation, and his heart rate was 200 beats per minute. He had a short convulsion at the clinic and vomited the rest of the toad, the head of the toad. The treatment included IV fluids, meropitan, activated charcoal, and because he had another convulsion, he was given diazepam to prevent future convulsions. That diazepam lowered the heart rate from 200 beats per minute to 160 beats per minute. And after 3 minutes, that heart rate went up again to 100 beats per minute, and he was given propranolol IV. After 3 hours, he only had chewing movements, but the heart rate again increased to 210 beats per minute. And they did an electrocardiogram that showed premature ventricular contractions, and they basically gave a bolus of lidocaine followed by a constant rate of infusion for 2 hours. And that kind of took care of the problem. And eventually he made a complete recovery and was discharged home. So this is a typical case that shows us the importance of treating the patient for each of the clinical signs that are presented. And as we saw in both papers, the prognosis is good if we act quickly and monitor the animal closely to prevent any CNS and cardiac effects that could kill him. So guys, this is the last slide for this presentation. So I will look forward to seeing you on the future ones, and so take care for now, and bye bye.